On Friday, Representative Rosa DeLauro and Labor Secretary Marty Walsh joined a roundtable discussion about a new registered apprenticeship program at the Yale New Haven Health System in Connecticut. The program, which is funded by the U.S. Department of Labor, plans to bring in over 1,250 patient care technicians into the field over the next 4 years. DeLauro spoke about her personal experience when she was hospitalized due to ovarian cancer, highlighting the importance of nurses and assistants who supported her during the healing process. Secretary Walsh also stressed the importance of making more investments in the healthcare profession.
Welcome. At this time, what we'll do is we'll have a nice roundtable discussion, a panel of apprentices who've been in this program, who will ask them questions, and they're going to provide us with their personal experiences. When I say your names, if you could just tell us your full name and the unit that you work on, that would be very helpful. Okay. And at any time, Secretary Walsh and Congresswoman DeLauro, if you want to ask any questions or provide feedback, you can chime in at any time. All right, excellent. So, Delia, I'll start with you. Which seminar have you found to be the most meaningful to you, and how have you applied it to your practice?
My name is Delia Cardner, and I am a patient care associate on the medical and surgical unit. Now, I must first say I am very grateful for this program. I have seen tremendous growth in my role as a patient care associate. Now, one of the main lessons that I have learned from the program is conflict resolution. At that point when we were discussing patient conflict resolution, there was a little conflict between a nurse and myself, like a misunderstanding. And during that time, I spoke with my mentor, and she guided me on how to deal with that problem. Now, after I spoke with her, I realized that not just for myself, but for her, how she relates to other nurses and patient care associates as well. Now, as it relates to communication, there was this difficult patient who always undermined our skills, making us feel as if we don't know what we're doing. But the way in which I dealt with that patient, in the long run, she said earlier, I know we have started out on the wrong foot, but overall, you're one of the best patient care as she leaves. So again, I want to thank you, thank the program for this tremendous work that you're doing. We are seeing growth in ourselves, and I think you should continue the good work you're doing.
Tanya, how has this program benefited you and your career growth?
Good afternoon, everyone. My name is Tanya Clapalcoyoa. I am a patient care associate in a medicine unit. When I was hired last year, I wasn't sure how far I was going to go into my healthcare career. As time passed in this program, I became motivated by my mentors and my fellow PCAs to become a preceptor and one day become a mentor to new PCAs. Our job can be very stressful, and without a good support system, it is very easy to give up. I recently precepted a new PCA on my unit, and as I listened to her positive feedback, it made me feel stronger. Now I know I can do this. I will finish my education in nursing and become a mentor to motivate and to support new patient care associates just like this program has done with me. Thank you all for the opportunity.
As it's been said, this job does have its inherent stresses in it. Janisa, can you tell us about how this program has helped with your stress management? Hi.
Oh, for me.
Hi.
I'm Janisa Boknay. I'm a patient care technician on MP12, which is the Smilo Cancer Oncology Center. Within my scope of practice, there's a lot of daily tasks. Some are already set in place, but in our fast-paced environment, providers can add urgent or stat orders into the system at any time. These orders include documentation of intake and output, of any type of bodily fluid, EKGs, which monitor heart functions, bladder scans, peripheral labs, elimination samples, and more. All of these stat and urgent orders have to be completed while handling our already set daily tasks, which include skin and wound care, elimination assistance, emotional support, documentation, and patient safety. There's also the reality of the unpredictable aspect of taking care of very sick patients. Caring for very sick patients, and I say this to explain the complexity of our everyday work life, especially during the beginning of COVID, which was long hours and short-staffed. But during this time, we were holding strong, and we were one of the only support systems most of our patients had physically and emotionally. This apprenticeship program provided me with techniques to deal with time management and stress reduction. And support from my cohort and my mentors has allowed me to share my experiences with my peers. During this time, we used critical thinking to reflect on our issues and problem solve together. These organizational techniques that we use in our cohorts, I take home with me in my daily life and apply all the time. So I really appreciate this program and the opportunity to actually sit here and talk to all of you today.
Denise, you work in a real high-tech environment. Would you be able to tell us a little bit about the technology that you use every day?
Yes. Hi, my name is Denise Streeter, and I am an ambulatory care associate with the Heart and Vascular Clinic. I manage the equipment. Our patient population receives a left ventricle assisted device. This device is used This device is used for patients who have reached the end-stage heart failure. The left ventricle assistant device is a battery-operated mechanical pump which helps the left ventricle pump the blood to the rest of the body, and I provide the necessary equipment they will be needing for discharge.
Thank you, Denise. And Stanley, I'm going to hand the mic over to you. Can you tell us about a patient interaction that was meaningful to you?
Good evening. Well, good afternoon. My name is Stanley Baxter. I'm a patient care associate on 5-3 Heart and Vascular. Recently, I had a patient on my unit who told me a little bit about his experiences in the hospital when he was a kid. He explained to me that back then there wasn't really diversity in the hospital, like as far as nurses or nursing assistants. He expressed that they really had very little diversity, and he was kind of happy to see that the way things are now, the nurses, the diversity in the nurses, and we could get along working together. As he spoke about this, it made me think that if I'm working in this type of field and I couldn't do the good work just because of what I look like, or you know, that doesn't make sense to me. But he went on to express that, you know, he appreciated the care that he received, and when I think about like excuse me, when I think about the people that came before me who were not able to do the simple good work that they wanted to do, I know that every day that I work, I represent Yale, but I feel like I represent much more.
Thank you, Stanley. Let's see. Now, look over this way, over to Denisha now. And if you could just tell us a little bit about how this program has inspired you to grow within this organization.
Hello, my name is Denisha Marshall, and I'm a patient care associate on neuroscience. And I work with people from different backgrounds and different ages. We have patients that are epilepsy, neurosurgery, neurology, and stroke. So I'm also on 2 committees on my unit. I am on the fall committee and I am on the entertainment committee, where so the fall committee is a committee where we talk about falls on our unit and how to prevent falls, as well as we have monthly meetings with my supervisors to go over how to prevent falls. And the entertainment committee is the committee where we collaborate ideas together as well as teamwork to do things together on our unit and off our unit. Like when we are on our unit, like we had a cupcake competition. As well, off our unit, we try to do an Alzheimer's disease walk. So yeah, and thank you guys again for this opportunity.
Thank you, Denisha. And Giselle, can you tell us about clinical reflections?
Yes. Hi, my name is Giselle Cotner, a patient care associate on the cardiac unit. And in our clinical reflections, we get to share the challenges we go through on our unit. One of my colleagues shared an experience that she had where one of her patients did not want a Black patient care associate to take care of them. So instead of her being defensive and taking it personal, she kindly asked them if she made them uncomfortable and what she can do to, prevent that. That really stood out to me because if I ever in that situation, I can use that statement instead of, getting upset or stuff like that. And I can also use that in our daily life too, because we, as Black individuals, we do go through that on a daily basis. So, just taking it easy and responding with kindness will actually help everything. So, yeah, thank you.
Thank you. And Kelsey, if you could just explain for us how this program helped bring awareness for best practice to your unit.
My name is Kelsey Snedeker. I am a personal care associate from the transplant unit. Based on what I learned in my patient hygiene class, I suggested to my managers to replace the use of baby powder, which is to nystatin, which is more effective and helpful to heal body creases. Also, instead of using warm water and soap, I learned 3-in-1 cleanser is more effective to the patient. So I then went back to my unit and suggested this change. I want to say thank you to this program for helping me with the tools to give great quality patient care.
Great. Thank you to our panel discussion from our apprentices.
Can you hear me? Yes, you got it. Wow. You blow us away. I mean, very, very sincerely. Really. I'm underlying what you're learning in terms of the academic portion of this life, the complex medical issues, diseases, whether it's neurological, if it's cardiology, and that's your specialty, Dr. Churchwell. Used to be. Well, it's like riding a bike. You're never going to forget. Anyway. But your individual experiences really reinforce the necessity for us to be engaged in this kind of an effort, and that the resources are important. And everybody spoke about shortages, and we at the moment don't have the supply to meet the demand. And in this area, I know I was hospitalized many years ago for a long time with ovarian cancer, and I welcomed the surgeons, and they were masterful. They did the job. They helped to save my life. But it really was the nurses and the assistants who came in every day and who could look at my face and know that whether I was having a good day or a bad day, and who could, help me support the healing, but not only the physical healing, but the mental healing that you are all engaged in. And that is what it's about. And some of you face different experiences, as Stanley tried to say, and as you pointed out, someone who sees you, they don't see you as the professional and the person that you are. And that makes it doubly difficult. But it sounds to me as if that you are coming to grips with that, which not only has application in your professional lives, because you're dealing with this professionally, but in your personal lives as well. I don't think, as a secretary, we could be making a better investment than what you have done at the Department of Labor to make sure that this program exists. Again, the supply does not meet the demand. We need you on the job. We need you. You will help us to keep a nation, and particularly in this instance, our community, healthy and safe. And we want you to know that you are not alone in what you are doing. You have the mentors, you have an administration, you have the full weight and force of this university and this healthcare system to lead you and guide you as you make your way to great success. So thank you. Thank you for sharing your stories. It takes great courage to speak. And I know I get nervous, etc. But you all were really great and very forthcoming. Thank you.
It's hard to add what the chairwoman said, but as you were all, first of all, your confidence is unbelievable, all of you. And I love the fact that, you know your profession and you're confident in it, and that's great. Secondly, you don't realize the behind the scenes of a hospital. When you're sick, or when you have somebody that's sick in the hospital, my mother was just spent 2 weeks in hospital and a week in a rehab. And, the family's not there all the time, and you are the family oftentimes. And And the fact that not only are you doing your job, but you're also thinking about what's going on behind the scenes with the different committees and thinking about how do you improve patient care, how do you improve, getting patients interacting, whether it's through entertainment or what have you. I want to thank you for that as well, because that does mean an awful lot. And Stanley, you said something that it took me back to being a kid. When I was a kid, I was in the hospital a lot, in Children's Hospital, and it didn't really dawn on me till today, till you said it, that my nurses and all the folks that come in, they all look like me, and they didn't look like you. And you think about that was 40 years ago, a little more than that, 40 years ago, 45 years ago. You fast forward today, and when I made the comment and when I saw you guys in the hallway, I was really impressed. That's important because it does matter. It does matter when we're caring for people, when we're caring for people that are sick, and understanding that. So I just want to say thank you for what you do. Thank you for choosing to go in this profession. And I say this a lot, you might never be fully, well, you are going to be thanked in your career, but you might never fully be thanked. All it takes is one person to make a difference in one person's life that's being treated in this hospital, and you've changed that whole experience the families had in the care. And the prior presentations, there was one piece that was end of life, and sometimes you're there for that. You'll be there with families, and you have that face of comfort. So I want to say thank you for what you do. And the chairwoman's right. We need to do more in the healthcare profession. We need to make more investments in the healthcare profession. We need to make sure, understand that we have the greatest healthcare system in the world here in America. It's not equal across the states, unfortunately, but it is here in Connecticut today. We can say that. So it's important for us to continue to make those investments and work with you. So thank you very much.
I just want to say one last thing. And I mean this, from, you get to work with a lot of different people, and you get to know what they care about and how they take on their role of leadership. And I just want to say about the Secretary of Labor, this is someone who is intimately engaged and involved with the mission of the Department of Labor. He gets it. It's in his DNA. And that to make opportunity available to everyone, and that it is your God-given talent that allows you to thrive and to succeed. He recognizes that. And so he will take the Department of Labor with its resources and make that the focus of what it does. That's leadership, but it's about who he is and what his values are. His values are yours. He wants you to succeed. And I'm so honored to be able to have the opportunity to work with him in these efforts. And we do work together, and we will look to see how we can create the resources that are necessary to continue these efforts.
Great, thank you. Do we have any additional questions or comments?
That's being put on the spot. I'll only take about a minute or two, but my name's Ina Williams. I think we've met. I'm the Chief Nursing Officer for the hospital here. And I think what we heard today is just remarkable, and nothing to add to that. But as I was sitting there, I was reflecting on the idea that this kind of thing does not happen without the right environment. And that, as you walk away from here, I'm sure through the stories that you've heard and the description of the program, that it is because we have an environment that really believes in what we're doing. That the entire community, whether it's the nurse managers, directors, preceptors, leaders in this organization, completely buy into this process. And we're committed with Judy who is really leading the charge and has led the charge for so many years, to be right behind her to support and make sure that they have all the resources they have, all the environment supports it, and that we can have the kinds of successes that we have today. So I just wanted to congratulate the rest of the people in this organization that helps to support something this magnificent to happen here at ELM Hospital. So thank you, Judith, and thank you to your entire team and all the members of our hospital. But know that we're completely all in.